We are with Dr. Rebecca Tarlton, and we are at Cure Point as of today.
As of today, yes.
Cure Point. Tell us about that. Tell us about the name change.
Well, we have been functioning as the Oconee Regional Cancer Center for about 20 years, but we decided to change the name to Cure Point because we actually have 3 centers, and we wish to kind of consolidate them all under the same name. We have a radiation facility here, obviously. We have a radiation facility in Waycross, Georgia, and we have a medical oncology facility in Douglas, Georgia. So we wanted to kind of consolidate everything under one name.
Okay, I like that, Cure Point.
Yeah, I think it's nice, short, and hopefully to the point. And we offer services with radiation oncology and with medical oncology, so hopefully combining those services will give patients access to all the modalities they need.
Tell me about your specialty, Dr. Tarlton, and what led you to this medical career.
Well, I'm a radiation oncologist. Cancer patients typically see radiation oncologists or medical oncologists or surgical oncologists, or all 3 as part of their treatment. What we do here is solely radiation therapy, which is treating cancers with radiation therapy.
What's the difference in radiation therapy and chemotherapy? A lot of people, do you often have both?
You can certainly have both. You can have them sequentially or together. Radiation involves treating cancers with high energy radiation, whereas chemotherapy usually involves either oral or intravenous drug treatments.
Okay. And what type of cancers would radiation be?
Oh gosh, we basically see all kinds of cancers. Probably radiation is most commonly used in the common cancers: lung cancers, breast cancers, prostate cancer, colon cancers, rectal cancers, head and neck cancers. We cover them all, basically.
Okay, I want to get back to what led you into the medical field?
Oh, the medical field. I've always wanted to be a doctor since I was a little girl, so no, that wasn't a big issue for me.
That's interesting, since you were little.
Yeah.
Very young.
Yeah.
Okay.
And why I went into radiation oncology, I was actually doing immunology and did a lot of research in multiple myeloma and was exposed to a big cancer hospital up in Toronto, and I just liked the field, so I switched my specialty. Yeah.
What are what's the latest research that's been done that gives us hope for a possible cancer cure?
Oh, well, I mean, there's obviously, as everyone knows, there's a lot going on in genetic engineering and what we call biologic treatments, and cancer treatment is becoming very patient geared, so you can individualize cancer treatments now, and that'll probably be the wave of the future.
Do you feel too that, I mean, I know this is kind of dramatic to say, but years ago when somebody was diagnosed with cancer, it was almost like a death sentence.
Oh, and
now there's so
not
much
at all.
hope.
No, not at all. I mean, gosh, you have to look at each individual cancer, but in most cancers we've made tremendous strides in terms of curing and or putting into a longer remission period. So, no, I don't think it's a death sentence at all.
So much hope. You've probably seen some really miraculous
We see some
things.
very sad things,
Yeah.
but we also see some really happy
hopeful
things.
things and
Yes.
wonderful things. What are some things that that we can do that could possibly keep us healthy? Does lifestyle, certainly we know smoking contributes to lung cancer.
And other cancers. I mean, there's links, smoking obviously, to head and neck cancers, breast cancer, bladder cancer. So smoking's a big one.
We think about
not just lung
variety,
cancer.
but
Yeah,
it's
no,
okay.
not just lung cancer. Health, other parts of your lifestyle, eating, obviously, less fat, exercising. I mean, all those have been shown to improve our risk of getting cancer, and even if we have cancer, to improve our cure rates.
What about screening? How key is that for us, for like colon screening?
Oh, absolutely. I think that have been good studies to show that obviously screening for prostate cancer, breast cancer, colon cancer has impacted on survival rates.
Okay. October is Breast Cancer Awareness Month. What are some things that you feel that are just absolutely key for women to do? We've had some things about mammograms that have been some negatives and some positives.
Right.
How do you feel about that?
Well, just to answer your first question, I think the most important thing actually is for women to perform self-examination, because not all cancers, as we know, are picked up on mammography. And I think if a woman feels something unusual or different in her breast, she should definitely seek medical attention no matter what the age. Certainly women much younger than the age recommended to start screening mammography, we're finding breast cancers at much younger ages now. So I think self-examination is key, and then getting regular mammography. The techniques have improved with mammography, and that's making a difference too.
Yeah, well, I think the examining your own body, a woman knows her body better than anyone else.
Oh, absolutely.
If there's something that she feels is a little out of kilter, then it probably is. So she needs to have it seen about. What are some things here at Cure Point that you want to let everyone know about?
Okay. Well, I think that that we have excellent technology here. Certainly, we can offer here to patients what would be offered in big centers. We, can use. We have a lot of experience with brachytherapy, which is meaning radioactive sources are implanted into the patient's tumor. And we certainly have a big program with prostate cancer patients and with breast cancer patients. So I think that's a very unique aspect of our program here. As far as typical radiation therapy, we have all the bells and whistles that you could get at a big teaching center. We have IMRT, which is intensity modulated radiation therapy, which allows us to focus the radiation on the tumor and spare the normal tissue around the tumor as much as possible.
Is hopefully not damaged.
Right, exactly. And that's always been the problem, that you can, if you can give enough radiation, you can destroy the tumor, but you can also do a lot of damage to normal tissue. So luckily, we're getting over those problems with radiation.
Okay. So when a patient comes in here, they see you, and then they're put in a private room.
Right.
I mean, this is outpatient.
Right.
So.
This is outpatient treatment. It's a process before they actually start getting their treatments. We obviously talk to them first, and then we have a lot of support with physics here. So once we decide on what kind of treatment a patient needs, they have a CAT scan here which measures where we're going to be giving the radiation. We have a team of physics people here that using various kinds of software determine exactly what the best way is to deliver that dose. Everything is verified before they get treated many, many times, so we're very confident that what we're treating is what we want to treat, and we're sparing everything else around it.
That's reassuring.
Yeah.
Truly.
So it's a process. It takes several days to get everything just the way we want it.
Okay. So you do have. Tell me about your staff.
Oh gosh. Well, we have
She's not here
great
alone.
stuff. We have how many? Four therapists who actually are the people that deliver the radiation treatment each day. We have 2 physicists. We have 3 nurses, one of whom is a nurse practitioner who also works a couple of days a week in our Douglas office, and she's capable of administering chemotherapy as well as helping with the radiation therapy side of things. And we have a lot of other ancillary staff. We have a social worker. We have people that can help, with that complicated process of billing and insurance and things like that. And we have quite a few people that work here. I think there's 14 or 15 here, and that many in our Waycross and Douglas office as well.
Okay, now did you ever go to those offices as well?
I've, on occasion, have gone to our Waycross office to do things that I can do that someone else couldn't do. Right, okay. Exactly. But I don't go to the Douglas office because that's just chemotherapy.
Okay. Well, now how long have you been here?
I've been here since 2007.
Okay, so well, we're glad. We feel blessed to have you here, and we want to take a look around.
Absolutely.
Cure Point, I like that. It's short and to the point.
That's right.
Dr. Tarleton, a piece of equipment like this can be pretty intimidating. Tell us what it does for us.
Well, this is a CT scanner, and we use it not so much for diagnosing patients, but more for treatment planning. So basically we're interested in scanning the area that we're going to be treating, and that gives us a very obviously accurate view of the size of the tumor, the normal structures around it, and that allows our physicists and dosimetrists to plan the treatment.
So this type of scanning is much more, I mean,
it only takes a few minutes, it's absolutely painless.
And it's much more accurate or whatever than an x-ray?
Yes, oh definitely. This gives us a whole three-dimensional look at a person, or the part we're interested in treating.
But this is pretty state-of-the-art equipment.
Yeah, absolutely. This is, I mean, CT scanners are obviously used for diagnosing everything, not just cancer, but
right. But it can be used on any part of our body.
Any part of our body, exactly.
Oh, good morning. My name is Rod Crossland. I'm currently at the medical center at Cure Point, the new facility's name. Not as a pleasure type thing, being my second term with these great profession here at this point. Last year we went through the lung cancer treatment, and now we found the brain problems. And I find these people very, very highly professional individuals, caring, and to the point, explaining procedures to my family and myself, and makes it really much easier to adapt to this seriousness of the problem that we face today in our society.
How did they find it? Was yours early detection or?
Mine, actually, I messed up my wife's Suburban over Jekyll Island, in front end of it, had a blind spot. Ooh. And I had to go to the eye doctor and found that I had a blind spot, and so he asked me to get an MRI, and that's when we found this little spot. And so immediately the staff, Rebecca, the physician here, called my wife and asked me and put me immediately on a medication, and immediately set me down for consultation with my wife and myself, and we immediately started treatment. She explained the whole spectrum of the procedure and what it would entail, and then we went from there. And I'm working on my thing. I'm almost down to like 5 more treatments at this point, and then we'll do another MRI.
I love Dr. Tarleton, but from your own, do you feel comfortable with her? I mean,
she makes you feel very, very comfortable, and the family also. It's like a one-on-one. It's not just a, well, you know, bedside manners, I guess, if you want to say, you know, the old adage of the bedside manner. She is very well at bedside manner, but it could basically be in the office. But the environment, she explained the whole scenario to you throughout the what's going to happen and what ramifications are like that. Of course, there's no guarantee, and we plan it day by day.
Dr. Tarleton, at Cure Point, and you've told us that there's also Cure Point in Waycross and Douglas.
Yes.
But for our area, right here in Dublin and Lawrence County, it's not just for Dublin and Lawrence County, because you cover an outreach.
Right.
So tell us about that.
Right. Well, we probably realistically cover a radius of about 50 miles. That's a long drive after 50 miles for anyone to do, but we would see patients even beyond that radius if there were no other convenient facility for them to go to.
So
obviously.
if somebody sees this or hears about Cure Point and they have something, a type of cancer that needs treatment,
Right.
what's the best thing for them to do to get here?
Well, the best thing is to ask their family doctor to refer them here, but we will certainly see anybody. They certainly can self-refer. Most of our patients come from our medical oncologists here in town, Dr. Agarwal and Dr. Kazi, or from our urology group, Dr. Weigel and Dr. Santa Maria. But really, any patient who is concerned, has a diagnosis of cancer, wants a second opinion, wants to be treated locally, there's no reason why they can't get great treatment here.
Well, and they could just come to Cure Point and sit down and talk with you or someone on
Oh,
staff.
absolutely.
And you could answer all the
Absolutely,
questions
and
that
we'd
they
be
may have.
happy to give them whatever information we have, and if they need referrals to other physicians, we'd be happy to do that as well.
I want to go back to October, which we have already touched on, and we've already said that October is Breast Cancer Awareness Month.
Right.
September is Prostate Cancer
Right,
Awareness
right.
Month. So, but for screening for
Right. I mean-
prostate cancer, that doesn't happen here. It's just
No,
treatment
that's
here.
typically done by the gentleman's own family doctor or urologist.
urologist, yeah.
And of course, blood test, PSA, has been absolutely phenomenal in detecting prostate cancers early. So the cure rates are wonderful for prostate cancer. I mean, early prostate cancer, we're curing in the high 90s, basically.
That
so
is phenomenal.
That is great. Yeah, I
So-
wish other cancers had that way of screening. That would be great. but-
So men should certainly have that done yearly after
Right, starting age 50, unless there's,
the
a
history of it
history in their family.
And the
Right.
same for women with breast cancer. If you have a history of breast cancer
Oh.
in your family, you should certainly have
Start early.
screenings very early.
Right, right.
Okay. All right. Well, we've enjoyed being here.
Well, thank you so much for coming.
I'm impressed with the facility and with you and with your staff.
Thank you.
And thank you for having us.
Okay.